For most people, healthcare feels like one of the most personal parts of life. It's where people go when they're sick, where families receive life-saving treatments, where doctors and nurses work to care for patients. Hospitals, clinics, and medical offices have traditionally been viewed as places of care. But over the past 2 decades, something unusual has been happening behind the scenes. The structure of American healthcare has been quietly changing, and much of that change has been driven not by doctors or hospitals, but by investors. Across the United States, private equity firms and large corporations have been buying healthcare facilities at an unprecedented pace. Hospitals, urgent care clinics, specialty medical practices, emergency room staffing companies, entire sections of the healthcare system are being acquired and consolidated. Many of these purchases happen quietly. A small medical practice might be bought by a larger network. That network may already be owned by a corporate healthcare group, and that group may ultimately be controlled by a private equity investment fund. The result is a complex web of ownership that many patients never see, but the scale of this transformation is enormous. In recent years, companies like United Health Group, CVS Health, and even Amazon have expanded aggressively into healthcare services. United Health has built one of the largest healthcare service networks in the country through its Optum division. CVS has moved beyond pharmacies by purchasing major healthcare providers and clinic networks. Amazon has launched healthcare services and acquired medical providers as part of its push into digital healthcare. At the same time, private equity firms have been buying thousands of smaller medical practices across specialties such as dermatology, emergency medicine, and anesthesiology. These firms often use a strategy known as a roll-up acquisition. They purchase multiple small practices in the same field and combine them into a single larger organization. From a business perspective, the logic is simple. Larger networks can negotiate higher payments from insurance companies. They can centralize administrative costs, and they can operate healthcare services at a much larger scale. But critics argue that this transformation may also change the incentives inside the healthcare system. When financial investors own medical practices, their goals may differ from those of physicians. Private equity funds typically operate on relatively short investment timelines. They acquire businesses, increase their value, and eventually sell them. That strategy can work well in industries like retail or manufacturing, but healthcare is not a typical industry. It involves complex ethical decisions, patient outcomes, and long-term care relationships. Some physicians say that corporate ownership can increase pressure to see more patients, perform more procedures, or reduce staffing costs. Supporters of consolidation argue that larger healthcare networks can improve efficiency and expand access to care. But the rapid pace of acquisitions has raised questions among regulators and policymakers. Because when healthcare systems become more consolidated, competition can decline. And when competition declines, prices often rise. Today, many Americans are noticing something strange. Healthcare costs continue to increase. Insurance networks are becoming more complicated, and the structure of the healthcare system seems harder to understand than ever. Behind much of that complexity is a quiet shift in ownership. Hospitals merging into large systems, medical practices joining national networks, investment firms entering one of the most important industries in the country. Most patients never see these changes directly. They still visit the same clinic, they still see the same doctor, but behind the scenes, the organizations running those clinics may now be part of much larger corporate structures. And as this trend continues, one question is becoming increasingly important. Who ultimately controls the healthcare system? Doctors and hospitals once defined American medicine, but today, the future of healthcare may be shaped by something else entirely: corporate strategy, investment capital, and the growing influence of financial markets inside one of the most essential systems in society. Because the quiet transformation of healthcare is already underway, and most people don't realize it's happening. If you found this video interesting, consider subscribing and hitting the notification bell so you don't miss all the deep dives we take into the systems that shape our world. And if you know other independent thinkers who want to understand what's really going on behind the headlines, share this video with them. Then help out these YouTube algorithms. Hit that like button. Ready for the next truth test? Let's go.